liver should kind of come to these little triangular margins on there too. If I saw hepatomegaly, then sometimes I'll actually see rounded liver load margins, and that can be a sign that we're having some hepatomegaly going on. Other things we can look for, maybe just increased distance from the diaphragm to the stomach. That's kind of subjective to think if there's any hepatomegaly. We can look at that. We should have a very normal echogenicity kind of throughout the entire liver when we're looking at it, which this one looks really good right now. So I like that. Looking for any signs of nodules or masses. Unfortunately, nodules can be incredibly nonspecific. So we typically do recommend aspirating any nodules if you want to try to get a diagnosis. We can't normally tell just from the look of the nodule if it's going to be a malignant or a benign process, but we see things like nodular hyperplasia, extramedullary hematopoiesis, vacuolar hepatopathy, kind of those are common benign things. And then for nodules, we can see anything from lymphoma to metastatic disease, anything else, mast cell disease. Unfortunately, sometimes they can even look 100% normal and still have actual neoplastic cells within it. So if you're trying to stage something, you still might need aspirates or liver biopsies to fully stage one of your patients. All right, anything else we need to look for this side? What I might do now is give me 1 second and I will flip him over so we can look at the right side of him as well. We're already 9 minutes in. I may All right, so I've done now. I've flipped him over. He is now in left lateral cumency, so coming over at that midline approach. Again, we've got liver. I'll sit kind of here to here. Here's the line of that diaphragm interface. You got the heart just distal to there. I decrease my depth just a little bit. So coming to the right side, a little bit better image of the gallbladder now, which is nice. So good image of the gallbladder, little gallbladder wall, that little hyperechoic round structure around this anechoic fluid-filled gallbladder. Looks perfect. We can come through there. And again, making sure once I'm in the sagittal plane, look at everything in the liver, the entire side, and then I flip it over into a transverse view with my probe and do the same thing, making sure I image the entirety of the liver and don't miss anything. So that looks perfect. Other thing I really like doing is getting myself an intercostal view while I'm up here on the right-hand side. So if I can come up on the liver from the left-hand side, I kind of see what's my most cranial loop of intestine. My most cranial loop of intestine is going to be the duodenum. If you think about that ascending loop of the duodenum, if you look at a radiograph, it's always all the way at the top, right? So here we go. And you can see the duodenum kind of sitting right up here now, which is beautiful. I'll look up here too for the pancreas, common bile duct. I'll look on here also that we can see typically really nicely on these transverse views. I can decrease my depth a little bit, go on like that, change my focal point, kind of sitting right down here. Now this is going to be pancreatic tissue kind of sitting right along the duodenum. So again, remember how the pancreas sits right alongside the duodenum. If you remember from anatomy class, we can follow the duodenum as it goes through. He just took a deep breath and moved his little duodenum down a little bit. Stay Maku. But there we go right here again, duodenum, and we got pancreas sitting right alongside of it. We're not going to dive too much into pancreas today. That can be for another day. But it's a good area right there to look at it and the duodenum and making sure I don't see any abnormalities there. Looks perfect. Let's get a little deeper of a depth again. There we go. Give me 1 second to find another image that I like to capture on here. Stay Maku. So now on the bottom of our screen, we start seeing the aorta. You can actually see it pulsating down there. Let me get that into view for you a little bit better. Right. Stay Mac. Sorry, he's taking some breaths and wiggling on me a little bit here. I gave him gabapentin, but that was the heaviest sedation I gave him. Lay down. All right. So here we got liver, aorta. Sorry, I don't have a holder right now. You can actually see kidney popping out. Remember, on the right side, you got the renal fossa of the liver, whereas the kidney will come into position there. Come on, Maku. Stay, buddy. Stay, buddy. Sorry, give me one more second. All right, so now we can see right along the level of that focal point, you can see a circular, take another deep breath, kind of pulsating vessel right there. So that's the aorta. So we kind of call this area, it's going to be close to the porta hepatis. So I've got aorta. It's going to be kind of running right along here. Then centrally, I should be able to get a view to also see the caudal vena cava, and then the portal vein would be a little bit more central when I'm looking at the three of these. Come on, Mac. All right. Sorry, one more minute here. So there we go. Get a couple of those into view. All right. Not getting a great view of that right now. I just need a little help with restraint on him, but we can do this when we're in person as well. But I'm doing kind of between the 11th and 12th intercostal spaces in a transverse view, try to get a view of the liver from there. And a lot of times I can see the aorta. And then we've got the caudal vena cava next, and then the portal vein will be a little bit more towards the center of the screen. And you can look at the three of them. If you're looking for shunts and things too, we're trying to rule out a shunt. Sometimes you can actually look at the portal vein to aorta ratios. And if we know we've got a ratio of greater than 0.8 between the portal vein to the aorta, then it's likely not an extrahepatic portosystemic shunt. When we start seeing ratios of like less than 0.65, then we start worrying about it a little bit more, and we'd certainly look at other things. If I also saw some microhepatica, some renal megaly, then yeah, definitely want to look at those vessels and everything too, and watching that portal vein and looking for any additional vessels that are probably going to be nice and tortuous down there that we can look for. All right. So that kind of sums up my liver gallbladder stuff. So again, looking at the echogenicity, making sure we image everything in our sagittal plane, come back, image in a transverse plane, making sure you've got everything that you've seen now. From right to left, left to right, image the gallbladder from both sides, making sure we don't see anything in the thoracic cavity. Now we're pretty happy. You can see all those portal markings again in the liver, and that all looks good. All right, thank you. And like an area of the pylorus sitting right up in here too. All right, let's pause.